Food allergy is extremely common. It affects almost 10% of the world population. Its classical and well-known symptoms are itchy and raised patches of skin, which is called hives, dry, itchy, scaly skin, which is called eczema, and itching and tingling in the mouth, lips, and tongue. Swelling of the lips, tongue, throat, and face is also a common symptom. Sometimes these classical symptoms are not present, and mild symptoms, which in reality are due to food allergy, are overlooked. We will describe the top 10 unusual manifestations of food allergy. The first such sign is nasal congestion, a feeling that the nose is constantly stuffy, especially in the morning. Even antihistamines may not help with such nasal congestion.
If a person consumes allergic foods regularly, the symptoms may last for weeks or even months. If you identify the food and eliminate it, the symptoms will go away within 2 weeks. The most common foods that cause nasal congestion are dairy products, milk, cheese, yogurt, butter, and ice cream. Teeth and gluten, so most bakery products, so eggs, peanuts, and nuts in general, sugar and artificial sweeteners. The second important sign is headache and food-induced migraines. When a person eats certain foods, and after this a mild headache starts or a migraine attack occurs, which lasts for several hours. People may say, sometimes I wake up with a headache, especially if I had something different to eat the night before.
And its common foods that cause such headaches are dairy products most commonly. Nuts, especially peanuts, wheat products like bread, pasta, cereal, and baked goods, sulfites found in dried fruits, wine, processed meats, and packaged food, chocolate, and caffeine, which sometimes cause headaches. The main point here is that when we talk about allergy, it classically means that something induces histamine release from cells, which causes an allergic reaction, blood vessel dilation, and nerve irritation, leading to redness and itching on the skin. But in the above mentioned cases, such as nasal congestion or headache, the main mechanism is not histamine release. Instead, it is caused by inflammatory mediators like interleukins, which trigger low-grade inflammation in the body. On the other hand, some proteins can cause delay-type hypersensitivity, like chronic sinus congestion from dairy, wheat, or soy. They use T-cell mediated inflammation, which causes an inflammatory reaction that lasts for weeks. And so many foods directly contain histamine, such as cheese, wine, fermented foods, nuts, and chocolate. They can trigger vasodilation and blood vessel widening, leading to headaches and migraines. The third common sign is chronic fatigue and brain fog. Symptoms can persist for weeks to months if the trigger food is consumed regularly. Some people experience brain fog within minutes to an hour after eating certain foods. Commonly, people describe it as, I feel drained after eating certain foods, but I don't know which ones. No, I get a weird mix of tiredness and anxiety after eating some processed foods. Such foods usually are dairy products, some meats, especially processed meats, and gluten products like bread, pasta, cereal, and baked goods. Also, sugary foods are a common cause of tiredness. They can cause sudden sugar crashes, leading to fatigue and brain fog due to rapid blood sugar fluctuations. It is not a pure food allergy, but rather a side effect of sugary food intake. On the other hand, artificial sweeteners like aspartame and sucralose may disrupt gut bacteria, leading to fatigue and mental sluggishness. Processed meats and MSG like sausages, canned meats, fast food, and Chinese takeout contain monosodium glutamate, which can cause headaches. Preservatives like nitrates and nitrites trigger low-grade inflammation and affect brain function. Another sign of food allergy can be sudden anxiety, irritability, or low mood. This can be due to histamine intolerance, gut dysbiosis, or the brain-gut connection. Such foods are usually gluten, dairy products, and artificial additives. The fifth sign is bloating and chronic mild digestive issues like occasional diarrhea or stomach cramps that come and go. It is often associated with irritable bowel syndrome, and it is not a true allergy, but it can have an allergy component. Dairy, gluten, eggs, and soy are the most common products that cause digestive problems of an allergic nature. For diagnosing food allergy, several important tests are used. The most common is the skin eye detects immediate allergic reactions, which are called EG-mediated. A small drop of the suspected allergen is placed on the skin, usually on the forearm or back, and a tiny needle pricks the skin to allow exposure. After 15 to 20 minutes, if redness and swelling occur, it indicates an allergy. Common allergens tested include peanuts, tree nuts, dairy, wheat, eggs, shellfish, soy, and sesame. However, this test cannot detect delayed allergic reactions like non-EG-mediated allergies. The oral food challenge is the gold standard. It confirms whether a person actually reacts to a suspected food. Under medical supervision, the patient eats gradually increasing amounts of the suspected food while being monitored for symptoms. It is used for confirming uncertain food allergy cases. In this case, there is a high risk of severe reactions, so it requires a controlled clinical setting with emergency treatment available.